This damage is progressive and permanent, basically a life sentence. They've done more and more and seen less and less healing because mechanical cleaning and killing bacteria in the mouth is not the solution. The answer is in the healing power of stem cells. Gum massage is not simply cleaning your teeth or your gums, it's stimulating a biological signal. This area needs help, needs repair. I eat dark chocolate as a stem cell medicine. Has your dentist told you that your gums can't heal, your jawbone can't grow back, or that those loose teeth eventually need to be extracted? Over the past 50 years, I've watched people reverse all three of those problems. I've seen patients who were told they needed extractions and had no hope because they had severe gum disease, others with significant bone loss around their teeth. And years, decades later, many of those patients had those same teeth still present, healthy, functioning, and in need of minimal dental care. So what's going on? In this video, I want to explain something most dentists in the past have never discussed for some reason: the role of stem cells in healing your gums and jawbone. And once you understand this healing process, you'll understand why some mouths continue to deteriorate year after year while others recover. This video is for anyone who has been told they have incurable periodontal disease. They have periodontal gum pockets that never go away. They need a gum or bone graft. Their teeth are loose, or that because they have gum disease, they cannot reverse it, and tooth extraction and expensive implants are your only option. Now, I'm not promising miracles, and I'm not suggesting you ignore your dentist, and I am not and have never suggested that dead teeth heal. Dead teeth cannot heal. They cannot be brought back to life. So if you have been told that a tooth needs a root canal or an extraction because it is dead, don't delay your treatment. Either get that root canal or get that tooth extracted as soon as possible, because it is dangerous for your body health to leave a dead tooth in your jaw. But gum disease and bone loss are different conversations. Neither your tooth, gum, or bone has died. These are living tissues, but often they get stuck in a chronic or ongoing bad situation that cycles round and round. So it appears there's no cure. The problem is how to get your gums out of this stuck situation and on the road to healing. Just like a car stuck in a ditch with its wheels submerged in mud. You could think that situation is hopeless if it is the first time it's ever happened to you. But if you know the specific strategies to use in this situation, lifting that truck out of the ditch is not impossible. It just takes the right effort with the right approach. And remember one thing: living tissues have an astonishing ability to heal if they are given the opportunity and the help they need. Now, many dentists believe that your gums can't heal. Dentists usually spend their careers watching gum disease progress, almost never healing. The best they can hope for is that your situation doesn't deteriorate and get worse. They see bleeding gums, deepening gum pockets around teeth that get larger as the disease progresses year after year. They see this lead to bone loss and loosening teeth. They see things going down a spiral of disease as patients return year after year with worsening mouth health, despite all their recommendations. So it is understandable for dentists to collectively conclude this damage is from some uncontrollable and ongoing disease. And this is why they often tell patients that this damage is progressive and permanent, basically a life sentence. But I am here not just to offer hope, but to tell you I absolutely know and believe the real problem is not that healing is impossible or that the disease is uncontrollable and progressive, but that in these situations, the natural healing mechanism has been blocked from working in the normal way. And that brings us to one of the most important concepts in all of medicine, that before any healing can occur, there must be infection control, which in the mouth does not mean you go for endless professional cleanings or try to kill the bacteria with aggressive rinses and antibiotics, but you use the opposite approach. You stop and control this infection by promoting a healthy environment in your mouth. Think about a cut on your finger. If your finger's healthy, it heals itself. How? Your body immediately kicks into action and starts something called a healing cascade. Blood vessels react, immune cells arrive, repair cells move into the area, and then new tissue forms so that the wound apparently miraculously heals. How much of that needed you? Did you have to go for medical help, or did your body do just fine on its own? Yes, that was simple, providing one thing. Now consider what happens if the wound is dirty and infected. Now healing slows down or stops. The body's resources become focused on fighting infection rather than rebuilding the tissue. If you cannot get the infection under control, it'll progress, and the wound will not heal, but can become seriously problematic, even dangerous for you and your body health. The exact situation happens with your gums. A periodontal pocket is simply a gap around a tooth, but it is easily filled by bacteria that are not healthy, and they can function as an infection in a wound. As long as that infection is active, gum healing is severely or completely limited. The body wants to heal, but it cannot effect repair. Now, with this fight in the tissues, it's easy for the surrounding bone to suffer. It's under pressure, and it can start to be lost, to dissolve away because of the infection. So it is the bacteria in the gum pocket that are the problem, because they never stop launching ongoing bacterial attacks. And despite flossing or dental cleanings, they will never stop. And any doctor knows that for healing, we must control the infection first. Unfortunately, dentistry has looked at the problem of gum disease from a mechanical direction for the past 50 years. They've cut the gums, scraped and planed the surfaces of your teeth. They have applied strong antibiotic chips and solutions. They've done more and more and seen less and less healing, because mechanical cleaning and killing bacteria in the mouth is not the solution. A reservoir of saliva provides instant new bacteria to take the place of the ones you just cleaned, scraped, or killed. And now we arrive at the exciting part. We know that changing the health of your oral microbiome will solve the infection problem. We nurture healthy mouth bacteria, and then the channels are opened up. The body can do its healing thing all by itself. This is how the gums can rebuild damaged tissues, and healing can begin. But how do the gums do that? Well, the answer is in the healing power of stem cells. When people hear the word stem cells, many think about embryos or lab research. That's not what we're talking about. I'm talking about the remarkable stem cells that already exist throughout every body. These cells are special because they're cells that have not yet decided what they want to become. When injury happens, stem cells can transform into any type of cell needed for repair. Skin cells, building blocks of blood vessels, connective tissue cells, and yes, cells that can repair your gum tissues. For many years, I taught patients about gum massage because I could see it worked. What I didn't fully understand was why. Then I learned something fascinating from Dr. William Lee, founder of the Angiogenesis Foundation. Stem cells are found in the lining, the inside of many venous blood vessels. When healing is needed, these cells can help build entirely new blood vessels that grow towards the area of injury. This process is called angiogenesis, and it may be one of the most important healing mechanisms in the human body. This is where things become practical. When you massage your gums with an appropriate toothbrush, you stimulate circulation. You also improve lymphatic drainage, which takes away some of the congestion and inflammation pressure. And this allows and encourages stem cells to start a process. The first step is the growth of new blood vessels into any damaged tissue. These new blood vessels bring oxygen, nutrients, immune cells, and they bring more stem cell supporting healing capacity to the area of your gums where it needs healing. In other words, gum massage is not simply cleaning your teeth or your gums. That massage is stimulating a biological signal. It's telling your body, this area needs help, needs repair. And providing there is no infection in those gum pockets, blocking the signal, then your body responds. That is why I have spent decades teaching gum massage as a central part of oral health. Not because it is mechanically scrubbing the gums. Don't press that hard. What you're doing is something to activate healing. Are there stem cells in our mouth? Well, not exactly in our mouth, but yes, they are in all the venous blood vessels surrounding our mouth. And there are lots of those in the gums, in the bones, in and around our face. And this is an excellent thing for the health of our teeth and gums. There's a lot of information about all of this in my new book, the second edition of Kiss Your Dentist Goodbye. It explains in more detail this process of healing, exactly how gums and bone really grow back. It helps you understand why your dentist says they can't. If you want this information in detail of how the body actually heals, stem cells and the blood supply, it's all there, and what this means for your gums. I also delve into foods that wake up stem cells and why artificially whitening your teeth, especially for children and young adults, could be damaging stem cells that are found inside teeth in the pulp on the inside. There are stem cells. You may be someone who mistakenly thinks dental cleanings can prevent or help you to prevent gum disease. Even many hygienists are trained to think this, or that you cannot cure gum disease. If that's what you think, my book will be very helpful to you, and you will see that killing and cleaning away harmful plaque is not a winning idea. Today we understand the oral microbiome, and this is the goal. Develop a healthy mouth and develop it before a cleaning, and then you'll be able to start on your healing journey. I have links below to other videos where I talk in detail about the difference between plaque and biofilm and how to improve the health of your biofilm, and in this way change the results you are seeing. You can't just rely on cleanings every 6 months to keep your gums healthy. It cannot. You need to know ways to maintain a plaque-free mouth and enjoy sustainable oral health for life. Now you'll find most of what I teach flies in the face of traditional American dental advice, which is why in my book I give science-based explanations, so you recognize and realize that the system I teach is not mine, but a method built on understanding the integrated science of our body and mouth. The first step is always clearing infection. And when it comes to gum pockets and gum disease, you have 2 choices today. One is LANAP, a dental office laser option. This is fast and expensive option, but dentists using it say it cures the infection, allows gum healing, and the bone can grow back. The other option is that you get your oral biofilm healthy first, using my strategies and slowly seeing natural healing. Slow is the word, as it can take 1 or 2 years. It requires your participation. But I have so much information in books and online to help you. And the good news? You can do this at home, spending less than $1 a day in over-the-counter products that you need. In a nutshell, I have lots of resources that talk about all these things. You simply need to do these strategies that involve using good oral care, my complete mouth care system with correct brushes and gum massage twice daily. The use of the prebiotic sugar xylitol will stimulate a flow of healing saliva into the mouth, and it will also feed good mouth bacteria. And adequate daily mouth resting is that special thing that allows saliva to heal your teeth and your gums. Then there are foods and things you can do to support your stem cells in your body, to help release them, and also keep plenty of stem cells around. and it gets a bit harder to look after stem cells as we get older. You see, older people, sick people, or anyone who's taken medications for years, anyone with diabetes, stress, chronically depressed, you may have a shortage of healing stem cells. And you may have noticed that you are generally healing more slowly. So for gum health, it does require, if you're older, being very careful to use all the products I recommend. And of course, work to massage your gums. It's also important to support the other parts of your healing mechanism, which means keeping your immune system healthy. This is more about digestive health, adequate rest, sleep, and of course, working to find a healthy diet with lots of fresh fruits and veggies. Dr. William Li, that I mentioned before, he has a lot of good suggestions about foods to eat for stem cells. In his book, Eat to Beat Disease, and online, he explains superfoods like chocolate and pomegranate that actually feed and help your body release more stem cells. My goal in teaching through social media is to reach people looking to help themselves. There's so many conflicting ideas in dentistry, and it's hard to decide who's telling the truth. I'm sure you've seen videos telling you to floss or use a soft toothbrush. I want to warn you, flossing can damage your gums, and that the only way to heal them is to do gum massage and use the products that I recommend, like my Complete Mouth Care system. I get it's difficult to know who to trust. And so, this is why I created my Gum and Tooth Rebuild program. I invite you to learn more about it. It's on my website, and it's at learn.drellie.com. This is a platform for this Gum and Tooth Rebuild program. It's a video training program that can help you. It's like teaching like this, how to get your mouth the healthiest it's ever been. My goal is to help families end generational bad teeth, because bad oral health will eventually damage your body in many ways. I want you to be confident, to know how to keep your mouth and your teeth vibrantly healthy for the rest of your life. And then you can teach your children and your grandchildren. I've spent years making videos on this channel, but it's difficult to sort through a little bit and decide which ones to watch for maximum help. That's why I prepared a library of these videos, checklists, and a 24/7 AI helper called Emily, trying to help it make it as easy as possible for you to get the information you need and want and put it into practice. This Gum and Tooth Rebuild program is managed by a team, and together we try to help you learn what you need to know, and we keep in contact and answer as many questions as possible. My hope is to empower you and teach you the science so you can be confident spreading the word to others who need help. Thank you for considering this program and supporting the passionate and committed team that helps me keep making videos like this. So now let's talk about something you can do tonight to support your stem cells, maybe using something already in your kitchen. So let me reiterate the 5 takeaways. Infection blocks healing. Healing requires circulation. Circulation brings repair cells. Stem cells support regeneration. Your body already knows how to heal. And if you want to speed this process, remember that stem cells are everywhere and that they can be fed. Certain foods stimulate stem cells. Happily, one of those foods is cocoa, the ingredient in chocolate. And yes, it's great for stem cells. There's a study from the University of California, San Francisco in 2010. The researchers discovered that 2 cups of high flavanol cocoa each day doubled the number of stem cells released into the body. So yes, I eat dark chocolate as a stem cell medicine. And if you're trying to heal your gum pockets, be conscious that foods can support this kind of healing. I prefer to use food rather than supplements, and it appears that certain phenols in foods can boost stem cell action. Ursolic acid found in fruit peels like apple, pear, cranberry, and blueberry peel, for example. Note here to buy organic, 1, wash the fruit as needed, And the smaller the fruit, the more peel it will have, and so more uracilic acid you will get. This is why small blueberries, for example, will deliver more medicine than those giant, oversized ones. Beta-glucan is another helper for stem cells, and this compound is found in mushrooms, which I had this morning, oats, and barley. Blue-green algae is also on this list, and I recommend you do a search and find out more as this amazing science evolves. Also, funny idea, it may be that as we smile, because there are lots of stem cells housed in an area of venous supply right here, as we smile, maybe we release stem cells. Does this help to keep our faces younger looking? I don't know. Or maybe while we're smiling, we squeeze stem cells into our blood system, and maybe that will help us live longer. Do smiling, happy people live longer? I don't know, but it's interesting. Perhaps smiling and talking has more benefit than we think. I hope you've enjoyed this video and find these ideas helping you to end ongoing dental problems you may have found previously depressing or uncontrollable. There are so many things we can do to help our own mouths. Why let harmful bacteria dominate your mouth year after year and cause that ongoing damage? If you'd like to learn more or review these ideas again at your own pace, as I mentioned, I encourage you to listen or read the second edition of my book, Kiss Your Dentist Goodbye. It's on Amazon, on Audible, and a link at drellie.com. It's a very concise, organized look at all the things we've talked about in this video and more. If you prefer other ways to learn, the strategies I teach are all at drellie.com. There's a free downloadable booklet about my system of mouth care, or you can explore my online course where I'm inviting members to live monthly teaching sessions just like this to answer their questions. You can also check out hundreds of YouTube videos here on this channel, and as I mentioned, some are from over 16 years ago. If you have found this helpful, please like, subscribe, and share this with friends and family. Until next time, let's keep you and your teeth healthy and happy.